One of the primary reason for knee pain is insufficiency. And if you carefully look, if I bounce it, it's going behind or towards the, bed. And that means if I hold it, look at how much hyperextension this knee is, because this has to be the neutral or 0 degree. Have a very young patient. I don't call her a patient. She is a professional. She'll tell actually what she was and why she came to us. We'll keep that a secret. And the reason for today's video is she is having an issue that most girls or women, young adults are facing in her age range. So she's 20 and she's suffering from something that most of her age group individuals have it. And what is that? So the reality is she came with what?
Knee pain.
Knee pain. When did this happen or started?
A year ago.
A year ago. And how do you think it happened?
Because I used to wear a lot of heels.
So this is actually a very common problem of having knee pain. Where exactly are you having the knee pain? This area is below the patella or the knee cap, and the other area is right over here. The most common reason of having knee pain in these two areas at such a young age group is because of problem or insufficient of quadriceps muscle, especially this guy over here, which is called vastus medialis obliquus or VMO. So she has problem in activating vastus medialis obliquus muscle. We will show you the x-ray, which actually gives us a real fact about why VMO insufficiency is bringing about the pain in the patellar tendon. Let's quick check the x-ray. So in the x-ray, as you can see, this is like a skyline view. I have inverted it because this is the correct viewing angle. They actually made a little bit of an error. This is the skyline view. Why? Because we wanted to see the patella in relation to the femur and the tibia. If you look carefully, this is actually the right side. The right side patella is much more laterally tracked compared to the left side. Left side is also tracking, don't get me wrong. So both the patella is actually on the outside. This is because the VMO is weak and it is unable to pull the patella medially, and this is called VMO insufficiency, and that is one of the reason why she having patellar tendinitis. So we will try to readjust the patella and the knee joint as a whole and see how she is able to handle that. One of the primary reason for knee pain is insufficiency, and if you carefully look, if I bounce it, it's going behind or towards the bed. And that means if I hold it, look at how much hyperextension this knee is, because this has to be the neutral or 0 degree. This is at a negative, probably 1 or 2 degrees, maybe 3 degrees, who knows what, but that is down. This means this angle is down. Cause for this hyperextension is quadriceps weakness and hamstring unable to neural control it. So we will do a little bit of a patellar move. The patella is obviously hypermobile in this case. Look at where the patella is moving medially. Look at how much mobile it is. So we'll do a little bit of a supero-inferior patella tracking. This actually helps to improve the mobility of the patella towards the quadriceps and towards the tibia or towards the patellar tendon, because she is having pain right over here. Second, done. We'll do a little bit of a traction and then we'll do a little bit of a glide. There we go. And done. So right now we are tracking or readjusting the hip joint, because that's one of the proximal joint close to the knee joint. One more time. Done. We'll do a little bit of a distraction pull. There. A little bit of an inversion pull. Then do a J swipe. One more time. Loose. Bend and then straighten. So what I am trying to do right now is stretch the patellar tendon and doing it actively so the brain remembers. And this is actually going to help in extensibility of tendons, because tendon is basically a non-contractile unit. You cannot stretch tendons as you do muscles. I mean, you can stretch tendons, but not as muscles. So this is going to help eliminate that problem and help in the efficiency of the patella to move up and down. And we'll do one more time. You good?
Yes.
You're not feeling any pain, right? Sweet. And we are good, because I'm able to feel that she is doing active resistance and power. Done. One of the best exercise to activate VMO is this. What you do is place your foot inwards and downwards. Keep it like so, the foot, and then straighten it. You can also do the same. Place your foot the inward and downward, in and down. Keep it like that and straighten your knee by tapping this muscle. Hold it for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Keep it tapping, 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 and one more time. So you can do this 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This will enhance the neural control and activation pattern for VMO, and this is very, very good exercise to improve patellar tracking or biomechanics of the patella. So you can do this 10 count, 10 repetitions, 2 sets, 4 times a day. So essentially 8 sets in a day. So right now, since we are done with the adjustment, we will ask my junior, Dr. Chakraborty, to come and tape this area. So because what we have done is reset the patella. Now to maintain her posture, we'll use tape or Kinesio tape to maintain the mobility and stability of the patella, including these muscles which can be inhibited and activated by the help of those tapes. So Dr. Chakraborty is here and he will be using these Kinesio tapes, as you can see, on her knee, especially the patella, and so that you can fix it to a certain angle and certain degree. Let's see what he does.
Hello everyone. So I am going to do the kinesiology tape. So for the new condition, purpose for the feedback for the knee movement, and also was the blood circulation. So basically the purpose of to use the foam roller is there is a need to be 20 to 30 degree of knee flexion, as because this is the open back position for the knee. This is a particular measurement I have done already.
So does the color difference makes any sense or
not usually. It is just for the targeting the desired structure. First part of the tape.
Alright, so he did a wonderful job. We have to test her out, isn't it? So we'll do like 5 half squats and check if she is feeling fantastic or not. So we'll do the exact same 5 half squats and check if she's doing fantastic or not. Alright. Great, thank you so much. Also, it's looking beautiful. It's like very stylish, isn't it? So it feels like you are like an Olympian or something. So I guess we really appreciate what Dr. Chakraborty did. And how long can she wear this tape for?
Sure. For he or she can use for at least 2 to 3 days for the desired effect, and it's clean and good feedback. So it's, although it is an adhesive, you need to be careful to not to be on the water. Water.
So, but she can take a bath and
she can take
rub it. So other thing that you need to be aware of, if your skin is hypersensitive, be aware of it, because sometimes what the adhesive does, it can create a little bit of bruising or maybe have allergic reaction. But these are all hypoallergenic tapes, and that's what Dr. Chakraborty is using, and I hope she feels better in no time, isn't it? Alright, how are you feeling now? Great. Alright, so stay fit, stay healthy.